I'm sorry. Um, well, first, let's hope you're staying safe and your family is too as well. I'm doing well over here. As you can see, I have on a hat because the barbershops are not open and I didn't want to do my debut on the camera with my head looking a mess. But first and foremost, I want to say thank you for this semester. Thank you for allowing us to tap into the healthcare industry and being able to see everything that goes on, even though we didn't get to cover as much as we wanted to. I'm just glad that I was able to be a part of the class and be able to give part of my voice is first and foremost of being a healthcare professional and not only being able to see it from my standpoint, but being able to bring some content to the class for those that don't work in healthcare and being able to see what I see through my eyes every day on a day-to-day basis. Um, just to start, I did do the watch the video Escape the Fire. And just to talk about it a little bit, I just really really liked the video. It really captured my eyes and made me feel like I was a part of what was going on in the documentary. Being able to just see what patients go through all over the country, not just in our population or in our city or state or whatever the case may be, but just being able to see it from other people's perspectives and other people's visions and goals and what they want to see come out of healthcare as well, especially the doctor that worked in Oregon, I want to say, and just being able to see what she wanted from the practice that she worked for, and she was not willing to give up until she got it, even if she had to, like she said, she was willing to just quit altogether and just go, I guess, find another job, just a regular job, and not practice anymore. Really compassionate part was especially the army, um, just watching what they go through to just with patience and the stuff that they had to endure coming back from the countries that they have seen the worst things happen before, and they never we would never be able to see those things, but the things that they endure while they're over there fighting for us, and then they come back with PTSD, all types of issues, and hurting, and not just knowing. Just one little snippet that I caught was the fact that them walking up a mountain and how it impacted one patient's back, and he had issues. He's having issues for the rest of his life. Overall, this just watching the system and how the system works and the things that were said and mentioned, it just really opens your mind up to what we deal with on a day-to-day basis. Another thing that captured my thoughts was the fact that they were saying 2.7 trillion spent in healthcare, and it's mortgaging our future. We're just paying what we're told to pay, and no one really knows what to, how to finagle this situation. We're spending $8,000 per patient a year, and we're still having the worst outcomes. In other countries, they're spending $3,000, and they may have and may not have the best out. They may have better outcomes than we have. It was just the overall great insight to see this video. And typically, we know when a professor tells you to watch a video, you're like, okay, here we go. Let me just watch this so I can get through it. But it was something that I really sat here and watched. And at some point, in little points, I almost teared up because just watching what patients were going through on camera, and we only just that 5 or 10 minutes that we see on the documentary what they're going through after the cameras are going off and everyone's going back to their daily lives. Another thing that popped out to me through this documentary, was one of the administrators just talking about how patients don't know how to empower themselves. This was one of the things that really captured me, because I see it on a day-to-day basis. You deal with it on a day-to-day basis, and you want to help that patient as much as possible, but if they're not helping themselves, then what is the need of doing anything at all? The population that I deal with is African American, predominantly African Americans, and all that they know is soul food and high cholesterol foods and sodas, drinks, alcohol, beer, you name it, smoking. Those are the things that and I'm an African American myself, and I'm trying my best to get them to live the the healthiest life that they can live possible. Um, you see it and you know it's something that can be done, but it's up to the patient that want better for themselves. Just a little haha moment for me is like they look at me and it's like I'm 40 years old and they're like, wow, you look so great. You look excellent for your age. And it's because of, yes, I take care of myself and I do what I'm supposed to do possible to make sure that I live the best life possible. Um, it's just more to it than what I can say in this little moment of this video. But just everyday basis, especially with me working in dialysis, you see a lot everyday. Patients don't be not what's the word I'm looking for? Not being compliant with their treatments, not coming every day, not the diets are not good. When we do lab work, the potassium levels are off, their phosphorus levels are off. They're not, taking their medicines like they should. They come into treatments with snacks and sweets and sit on the machines and eat. And we're like, okay, you are here to get this fluid off of you, but you're sitting here eating a Big Mac. But there's nothing you can do about it. It's up to the patient. And even with now, now that, with COVID-19 being around, we've changed the way things have, that patients can't eat on them while they're on the machine no more, while this pandemic is happening to us. But overall, just the little things that I've endured in healthcare over my last 20 something years of working in it, I've seen a lot of the stuff that was captured in the video. And it made me feel like I was like right there with them as they were filming it as well. Just a little background about my paper. I wanted to add this in the video as well. I did do my paper on healthcare insurance and healthcare benefits. And I just pretty much talked about how when you're, every year we come up at that time where we have to do our benefits. Well, when we do our benefits, we're always looking at how much we have to pay and how much is going to, how we're making sure that we're getting ourselves ready for the next upcoming year to make sure that we're prepared for if anything happens or if anything comes up that we're going to be insured. And how even when you're going to pay your co-pays at your doctor's office, your dentist visits or chiropractors or wherever you may be going, there's a chance that you're still going to get hit with a bill at the end. When you go home 2, 3, 4 weeks later, you walk to your mailbox and you have a bill in the mail for $200 and some, and you're like, okay, why do I still have a bill and I have healthcare benefits? And for me, it's been upsetting, well, more frustrating than anything, because I have to, pay this on my own. I'm not married, I don't have any kids, so all of it falls on me. And it's like, okay, $200 and some every pay period. That's a lot coming out of my pocket, especially when you just, you feel like, okay, this insurance should cover me for the year. I shouldn't have to worry about anything. But yes, there's those underlying things that come up that, you still have to pay extra for, that we never really know what we're paying for. As I was doing my research, I found that, it's not the fact that, oh yeah, you're paying more because you are getting lab work or you're getting a chest x-ray or you're getting some prescriptions done, field or whatever. But the fact is that, the population alone has caused this increase in our healthcare benefits that's leading us to have to pay more when, you have chronic conditions, you have people that are taking a lot of medications, and pharmaceutical companies are, every day making, creating new drugs. And, the patient load is going after these drugs. Having the doctors are prescribing these drugs to these patients, which means that they're paying more. Now that we have it where the Healthcare Reform Act is where, all the patients are not allowed to have, have benefits. to get the treatment that they need, to get health care, to be provided with health care. So now these doctors are having to go in to Joe Blow, and this patient, Joe Blow, has never been to a doctor, never been to a primary care provider, never been to nothing, and having to find out if he has any underlying issues, whatever the case may be, to get him worked up to get back to a healthier life. Let's hope and pray that he stays in that healthier life set, that he does everything possible to not have to be admitted to the hospital or be treated long term for anything. So in that meantime, what I gathered from that process is that it's going to make my premiums go up, because now that we're having to take care of someone else as well under my healthcare benefits. I hope that I grasp that concept as correctly as possible. I did do some research, and just a few things that I did find kind of made sense to me, and it was like, oh, ha moment, it's not just me, it's everybody that's going through this. Just overall, Dr. Jonas, I would just like to say that, everyone needs to really take a look at everything that they're doing, especially now with COVID-19, especially living a healthier lifestyle still, especially now that we're home, making sure that we're eating right, we're getting out walking, we're getting out getting great exercise, and we're making sure that we're staying on top of our appointments, whether it be virtual or, if the world ever opens back up, going to our doctor's office, going to see our doctors as much as we're supposed to. We need to keep in mind that we are in a time where we don't know where day to day what we're going to be going through with our health challenges, especially healthcare challenges as well. We need to make sure that we're doing the best thing possible, especially staying safe, staying healthy, making sure that we're eating right, making sure we're drinking fluids, as water, no sodas, no juices, nothing with dyes in it or anything as such. But people will always have those cravings and continuously drink and eat whatever they want because they don't have any other outlet. You never know what someone is going through in this time, especially. Other things that I covered in my research paper as well was the simple fact that that people don't. I'm sorry. Oh, I'm sorry. One thing that I'm hoping to take away from my video, but just a couple of other things that other things that I covered in my my research paper as well, was the fact that for me, going back to my experience again, just working 2 jobs, going from one hospital to a clinic, and just day to day, I have to look at charts. So it's just like I look through and see where patients have been, and it's just like they're just going all over Mecklenburg County from one hospital to the other to ER visits. And yes, in some cases it has trimmed down because we're getting a grasp on calming that down as a process, especially with the opiate crisis and everything, making sure that patients don't, be getting all these medications and everything. But just looking at, I remember there was a time where patients were just jumping back and forth from hospital to clinic to hospital, doctor's offices, just pumping from, pain clinics, management, just really revving up just going all over the city and getting everything that they possibly can. One comment that I wanted to make was, even with me going to a doctor's office, I remember hearing a nurse saying that, how patients were just coming through she said, I see them all the time. You get to know these patients so much because they come in there all the time. A couple of other things that I do want to mention was, Dr. Jonas, was the fact that how the populations have changed. Looking at the older population versus the younger population, a lot of the older population are trying their best to stay out of the hospital. I know for, past experience, especially now current experience, working in dialysis, a lot of the older patients do their treatments, do what they're supposed to do. But now that we're seeing a slight change in the patient load they were getting, we're getting a lot of younger patients, and a lot of them don't even show up for treatment. So, which that means that it's costing us money and it's costing everyone else money, because you have the supplies, you have to pay your staff, you have to pay the clinic bills, everything that comes with the equipment, supplies that goes with that equipment. If it's not being used, that's money going out and going in the trash. So it still has to be paid for. Um, a lot of the patients feel irreplaceable, especially the younger population. They come when they want. If they do come, they don't stay their whole treatment. If they do come, they come late and they're not able to get out their treatment as needed. So it impacts them more, and then sometimes they end up getting sick because they haven't been coming in on a regular basis. So now you have to take that into consideration and sending them to the hospital. So now you got medic involved, which is a bill. Getting them to the ER, that's another bill. Medications, labs, all that workup that goes into that process that people don't ever really think about. Just from the inside alone, it's just, when I started thinking about this, and I was like, I'm just like, why I pay so much? Then when you start really breaking down the system and how the things work and how things are transpired, you really start to get a aha moment and just say, okay, this is what it is. And if we don't get this situation under control, if we don't get these problems really impacted and looked at for years to come, we're already in trouble. We're really going to be in some serious trouble with our healthcare benefits. Overall, Dr. Jonas, again, I would just like to say thank you for your time, for your efforts, and I pray that you stay safe. I hope that your family's staying safe and your dad is doing okay. And thank you again for your class, and I hope that you teach something else soon that I can be a part of and be able to just voice my opinions. Thanks.